All right, so now we're going to look at mechanisms of disease. Okay, so there are different causes of disease. Remember, we talked about etiology, where it's going to look at the cause. There's kind of 6 categories we want to look at based on these causes. We have heredity, trauma, inflammation, and infection. They're kind of in the same group together. Hyperplasias and neoplasms. Nutritional imbalances, and impaired immunity. So we're going to take a little closer look at each of these. So when we look at heredity, guys, this is a hereditary disease, meaning there's an error or a mutation in an individual's genetic code or chromosomal makeup. So guys, we could actually have just one little mistake in the genes, the genetic code, or we could actually have too many chromosomes, not enough chromosomes, a piece of a chromosome could be missing or added. There's a lot of things that could happen genetically that could cause some of these diseases. Now, some of these diseases are also considered congenital. So if it's a congenital hereditary disease, this is a disease that is present at birth that's going to be found in the genes. Now, classifications of hereditary diseases here, we can have a single gene abnormality, meaning that there's only one thing that's kind of wrong. When we look at a single gene, this would be something like sickle cell anemia. We also could see this in something like cystic fibrosis. We see that there's one issue, and a lot of times it's going to be recessive. It could be dominant, but most of the time it's going to be recessive. Okay, and so if you have 2 copies of that abnormal gene, then we see that there's a mutation, the problem. We also can have an abnormality in several genes. Several genes could cause issues in multiple areas of the body. Several genes might be like a deletion, where we're missing a piece of a chromosome. So something like missing a piece of chromosome 5 causes the issue with what we call cry du chat, or cry of the cat. We also could have an abnormality in a whole chromosome. Okay, so when we look at a chromosome, we could have too many. These are known as like trisomies. You have 3 copies of the chromosome when you're only supposed to have 2. Down syndrome is an example of this. On the other hand, you could have not enough copies. There's only one monosomy that is survivable, like to birth, and that monosomy is Turner syndrome, where a female's born with 1 X. So instead of having 2 X chromosomes, they have 1. All right, so these are genetic issues that are causing a disease or set of symptoms, syndrome type of thing to occur. So guys, this is just showing you some examples. So we have the single gene, could be things like cystic fibrosis, phenylketonuria, which is PKU, sickle cell anemia. We have some polygenic type, meaning multiple genes. This is something like gout, hypertension, congenital heart problems or abnormalities. Chromosomal issues would be things like Klinefelter syndrome, Turner syndrome, and Down syndrome. So these are just some examples. There's a lot more out there, but these just give you some examples. All right, so now let's look at trauma. Trauma is when there's a physical injury that's taken place. A lot of times the physical injury could be due to an external force. Okay, so an external force exerting on the body, which causes there to be injury. Now there's different types of traumatic diseases, and those are a lot of times going to vary based on a number of risk factors. One being age. We see that older individuals are going to be more prone to having falls, where they fall and end up hurting themselves and having some sort of trauma. On the other hand, we see that gunshot wounds, which is from an external force, tend to be more common in young adults. All right, so a lot of times based on our age, depending on where we are in life, there may be certain traumas that are more common. Okay. We also see that traumas, guys, are the leading cause of death for children and young adults when we look at traumatic types of physical injuries. We also see that race could play a role when we look at traumas, and also your residence, where you end up living. If you live in an urban area or highly populated area, there may be a higher risk of certain kinds of traumas versus if you live in a rural area. All right, whereas like farmers living in a rural area may have certain kind of traumas that are more present than those who live in like downtown Chicago. All right, so your location can also play a role in the types of trauma that you may experience. Now, when we look at this, there's some classification when we look at trauma, and these are actually put in order based on their prevalence, like how often they occur. So the most common type of trauma that we see is motor vehicle accidents, also known as MVAs. We then see below that is poison. Okay, so being poisoned would be underneath that for a type of trauma. The next is through firearms, so some sort of trauma due to firearms like a gunshot wound. We also have then falls, suicide, suffocation, and then homicide. So these are the kind of prevalent type of traumas that we would see going from the most likely down here. Now again, these are not the only type of traumas that are present, but this is just giving you a list. Now, when we look at the whole idea of traumas, this is going to come into play with emergency management. When you go into the medical field, especially when trauma is going to be potentially coming in like in an ER setting, you're going to have to be able to manage these traumas. And one thing that they do a lot of times is they have to do something called triage. When we look at triaging, this is where they're going to look at the priority of the care. Now, it doesn't seem quite fair. You think, oh, it should be first come, first serve. But if you were ever to go to the ER and you are potentially complaining of like a sprained ankle, okay, you were playing a particular, let's say, basketball game, you sprain your ankle, you're going to the ER because it's on the weekend, trying to get some help to help with your pain and see if it's broken. You will go into the ER and sign in, but then if somebody comes in from a motor vehicle accident and is in critical condition, they're going to be treated first over you. Okay, this is called triage. We're going to take individuals who will have this higher priority, this higher issue, and they're going to be seen first. And a lot of times what they're going to look at is what we call the ABCs. Okay, do they have an issue with their airway? Are they having troubles breathing? Do we see a circulation issue where their heart's not pumping? If those three things are present, they are going to normally get worked on first, okay? Because that's what the whole idea of CPR and life-saving type of acts need to be done, okay? Versus your sprained ankle. Doesn't mean that you're not important, that you shouldn't be seen. It just means that they may need to be seen first. Okay, so triaging is part of this. Also, if a huge trauma was to come in, if you watched Grey's Anatomy or something like that, you would see that this happens quite regularly when they have like a huge disaster that takes place. Triaging will come in, and some individuals are so injured that it's not worth wasting the resources on them. They can't save their life anyways, and so they move on to the next individual that they can save. All right, so sometimes they have to make that tough decision. We talked about some of that medical ethical type of stuff last chapter. That would be come into play when we talk about triage. The next group that we see is inflammation and infection. Now, these are not the same thing, guys. When we look at inflammation, this is a protective immune response that is triggered by an injury or an irritant. There are some cardinal signs to inflammation, okay? These signs include, when we look at heat, the area will become hot because blood flow increases to the area. Since blood flow also increases to the area, it's going to appear red. Okay, so blood is warmer than the rest of your body, and it's going to give that red appearance for that inflammation. Another thing is, as the blood is coming into the area and it's going to dilate the blood vessels, we see that some of the plasma leaks out, and this is what causes the edema or the swelling. When we have edema or swelling, we see that pain a lot of times comes along with that. We see another thing that might occur, especially when we talk about like your finger. If you have inflammation there, it makes it not as usable. So you may have some loss of function due to that inflammation. Now, infection's a little different. Infection is where an invasion has happened by a microorganism into this tissue. This invasion is what's causing cell and tissue injury, which does result in inflammation. But you guys, you can have inflammation without infection. You normally can't have infection without inflammation. All right. And so inflammation does not necessarily mean it's infected when we have a type of wound or injury. Now, when we look at inflammation as well, a lot of times it's going to end in itis when we have something that deals with inflammation. So when we look at this, you might have like tonsillitis. That's going to be inflammation of your tonsils. Appendicitis is an issue and inflammation with your appendix. Okay, so anytime you see itis on the end of the word, it's going to be pertaining to inflammation. The next classification we have are the hyperplasias and the neoplasms. This is where we're looking at growth, and growth that's not normal growth, okay, of our cells. So hyperplasias are an overgrowth in response to some type of stimulus. Now, sometimes a hyperplasia could be due to the fact that the organ is stimulated too much and growing takes place. You might have heard of individuals who ended up having like an enlarged heart. Their heart is working so hard that it starts to get larger. This doesn't make it more efficient and better at its job. It actually causes more problems, but it is getting larger. We see the same thing if the thyroid gets overworked. It causes a goiter, looking like a tumor in the throat, to take place. Those are what we consider types of hyperplasias. Now, hyperplasias could potentially lead into the next group, which are the neoplasms. The neoplasms are known as tumors. This is where we have a set of cells that are growing uncontrollably, and they create a type of tumor that's present. Now, not all tumors are cancerous. Okay, we normally think, oh, tumor, cancer. Not necessarily. We'll talk a little bit more about that in the next chapter, but a lot of tumors can turn into cancer. If they are cancer, though, the person who studies cancer is going to focus in the field of oncology. So a lot of times you would be referred to an oncologist. That is somebody who specializes in the study of cancer. So guys, if we do take a look at this, you can see types of tumors listed here. This is in table 2-2. We see you have like what we call an adenoma. Adenoma usually is going to describe a benign tumor. This is a tumor that's not considered cancerous. Now, can it cause problems functionally? Yes, but it's benign, which means it's normally encapsulated. You have carcinomas, which are malignant tumors. Malignant tumors are cancer. A fibroma is a benign encapsulated tumor. Glioma is a malignant tumor in the brain. Okay, those are neurologic cells. A lipoma is a benign fatty tumor. Okay, so it's a fatty type of tumor, normally going to be more superficial in the skin. Melanoma is a malignant tumor of the skin. Melanoma is the skin cancer that is deadly. And then we have sarcoma, which is a malignant tumor arising from connective tissue like muscle or bone. So these are just some examples. And you'll notice that all of these are ending in oma, okay, O-M-A. This particular suffix is going to be diseases that have tumors. Okay, so tumors, remember, doesn't necessarily mean cancer, but if a tumor is present, we may add oma to the end. That's a suffix that lets you know it's a tumor. Now, when we look at neoplasms, they are going to be classified in a number of ways. And again, this is going to be with oncologists. They're going to, in oncology, you're going to focus in on these guys. But if it is a benign tumor, it has got limited growth. All right, it's not going to just grow uncontrollably. It is going to be limited. It's also normally encapsulated, covering in a capsule, so it's not going to spread. All right, it's not going to do what we call metastasizing, where it spreads to new areas. However, the more of these cells that start dividing and losing control of their cell cycle, it could lead to malignant type of growth. This is uncontrolled growth. If it is malignant and it's uncontrolled and it's no longer encapsulated, that's what we call cancer. Cancer is a malignant tumor. Malignant tumors, as they start to divide, they normally will metastasize. Metastasize means they move to a new area and they spread. This is where you hear individuals that are like, yes, I was diagnosed with lung cancer, but now I also have cancer in my liver and my kidneys. Normally, that's the lung cancer and it's spread to other areas. It's what we call metastasized. Metastatic means it moves from its site of origin to a secondary site in the body. This is what allows us most of the time to grade cancers. Okay, when they say, or stage them. When they say, well, I have stage 1 cancer versus stage 4 cancer. Stage 1 is where the cancer is a little more contained. It's not as uncontrolled. Stage 4 means it's going to be metastatic, meaning it's spread through the body, a lot harder to treat. So if we talk about prognosis, remember that term of like the outcome, prognosis for stage 1, early detection, hasn't spread, is better, okay, than the prognosis for an individual who's in stage 4. All right, because it's spread so much, it's a lot harder to treat. Another classification for disease is nutritional imbalances. Nutritional imbalances are usually related to either an overconsumption of something or an underconsumption. This is one reason why good nutrition is so important. Okay, one of the main things we need to focus in on nutrition wise is kind of looking at that food pyramid, having what we need in every kind of area, not overeating in one and ignoring others. Having a well-balanced diet is super important for the number of minerals, vitamins, and different things you might need for your body. Nutritional disorders can actually start to affect a lot of times physical growth, as well as mental and intellectual mental retardation and intellectual problems. It could cause learning disabilities and things like that if we are not giving the body the different nutrients that it requires. So some specific problems that we see that happens with nutritional imbalances is we could have malnutrition. Malnutrition means you're not eating or consuming enough of those nutrients. We could have the opposite, which is obesity, where you're taking in too much of that food. We could also have excessive or deficient amounts of vitamins, minerals, or both. Okay, so it could be a combination of a lot of different things. Now guys, when we look at malnutrition, this is due to inadequate amounts of nutrition being taken in, or nutrients. Diseases that cause a problem with absorption of nutrients could lead to malnutrition, like if your stomach or your intestines is not able to absorb your food correctly. This is something like Crohn's disease. A lot of times it is going to cause inflammation and problems within the intestines, and it can't absorb properly, which could ultimately result in malnutrition. Tapeworms. The person might eat, but the tapeworm is taking all the nutrients. Again, it could cause the patient to have malnutrition. One thing we can see that happens with somebody who is not getting the nourishment they need is called cachexia. Cachexia is going to be a term we use for an ill, thin, and wasted appearance of a person. Okay, so they're very thin, they have a wasting away look, and you can see that here in the picture, and a lot of times this is due to an illness. Individuals who have advanced AIDS, okay, not just the HIV positive, they have AIDS, will start to have this problem. They start to develop what we call anorexia, which is where they cannot eat properly. Now, this is not anorexia nervosa, which is a mental issue of eating, although it still can cause cachexia to happen. When we talk about anorexia, when you're already sick, have you ever been so sick you just don't want to eat? Doesn't feel good. It just don't want to eat at all. That's what happens to people who get super sick. All right, and so that's one of those things that can occur. On the other hand, we have obesity, and in the United States, obesity is a bigger issue. This is when your body mass index gets to be too large, okay? You're getting too many nutrients, you're overeating. This has actually led to a whole branch in medicine called bariatrics. Bariatrics is going to be a type of branch of medicine that's going to focus in on a lot of times like gastric bypass, things like that are going to help with reduction of obesity and weight. Now, one of the things that tends to happen, especially if somebody is malnourished, they're not getting the nutrients they need, we may need to put in certain kind of measures to help them get the nutrients they need, okay? These alternative ways of getting nutrients to the individual may include what we call parenteral. This is the administration of types of fluids or nutrients through injections. Okay, so through some type of injection that is present. This could be an IV. This could be through what we call total perinatal nutrition, or TPN, okay, where you may have to get an IV in to get that TPN through your body. But those are going to be normally kind of short-lived. They put the IV in, they give you what you need, and then we move on. A more long-term help when we're talking about getting nutrients to somebody is going to be an enteral route, meaning they're going to have a feeding tube. This feeding tube is going to give nutrition through their small intestines, so straight into their small intestines, and they'll have a type of port. Okay, so we can see here that you have different ports. If the port is in this stomach, that's in the first picture here, that's what we consider a gastronomy. We also then see that we could be in the intestines itself. Okay, but this is a type of feeding tube, which means it's going to be more for a long-term help with nutrition. All right, so some health highlights here, guys. There's some general guidelines for a healthy lifestyle. Some of these guidelines include maintaining a proper body weight, okay, knowing kind of your body mass index and what's good, okay, and kind of trying to stay within that range. Eating a variety of foods, not just focusing on one particular type, but a variety, that food pyramid where you're getting a lot of different things like fruits, vegetables, grains, dairy, that kind of stuff, if your body can handle it. Avoid excessive fat, salt, and sugar intake. Okay, now especially processed sugar, and a lot of your processed foods are going to be high in salt. Okay, they're also going to be high in that sugar, and so those types of sugar and salt is not good for you. Having more fresh foods, staying on like the edges of your grocery store is better than going into the middle. Now granted, the middle area's got the stuff that has the good shelf life. It's the stuff that you can buy and you don't have to go to the store for 2 to 3 weeks. Okay, but the stuff that's fresher is going to be better for your body. Also, eat adequate amounts of fiber. Consume alcohol in moderation. Now you'll notice it does not say not to drink alcohol at all. Okay, things are not necessarily bad if they're in moderation, but this means no more than 2 drinks per day for men and 1 for women. And this is not just, so when we talk about drinks, this doesn't mean like the whole bottle counting as 1 drink. All right, and so it's using those normal amounts where only it's a certain amount of ounces, that sort of thing. Also, get enough rest and sleep. You should get at least 7 or more hours per day, okay, of sleep. Always eat breakfast. Now, you'll see a lot of times right now with intermediate fasting where it talks about not eating breakfast. But guys, most of the time when we eat breakfast, it jumpstarts our metabolism. It starts that process of our body doing what it's normally supposed to do. And when we eat breakfast doesn't mean it has to be the biggest meal of the day, okay? But eating something to help jumpstart that metabolism. Maintain a moderate exercise schedule. Now guys, a moderate exercise schedule doesn't mean it has to be extensive and every day. Okay, if you were to just have a brisk walk of 30 minutes about 4 to 5 times a week, that's actually beneficial to your heart and your body. All right, so it's not asking you to be a bodybuilder or a Olympian with weightlifting or a marathon runner. It's just saying that you need to have movement, okay, moderate type of exercise at least. All right, the next area of disease we want to look at is impaired immunity. Okay, impaired immunity is going to mean where your first line of defense or your line of defense, your immune system is impaired somehow, which causes you to be more susceptible to invaders. So your body's first line of defense is your skin, your mucous membranes, which are the linings of all your natural openings, your tears and other secretions like your saliva, stomach acid, that sort of thing. These things are there to help protect you and act as a barrier. Now, sometimes they get disrupted, okay? Let's just say you have a cut and your skin is compromised. That can potentially allow invaders in, okay? Your mucous membranes, you get something in there that irritates that mucous membrane, causes it to be able to let in a virus or a bacteria. Again, we see that there could be an issue. We see that your immune system has protective qualities. You have special cells called leukocytes. Okay, leukocytes are white blood cells and they help kill foreign invaders. You have lots of different types. And as long as they're all working, they help protect you against those invaders. Now, it does not mean that they stop the invader before it actually makes you sick. Sometimes you get symptoms and all, and this is your immune system trying to fight the invader. It takes time, especially if it's a new invader that your body hasn't seen before, okay? But a really cool thing about these white blood cells is a lot of times they create what we call memory cells, and they remember what you fought before. So if you're exposed again to that particular disease, your body is more ready to fight. Your body reacts to these antigens, okay, these invaders, by producing antibodies as well. Antibodies are kind of like missiles or arrows that help besides just hand-to-hand combat with your white blood cells. All right, so our immune systems have lots of different ways to help potentially protect us. So guys, antigens, when we look at antigens, those are substances that can cause harm or set off a specific response of your immune system. In other words, it's something that does not match you. Your immune system is taught, this is you, this is not you. So if something comes in that does not look like you, it should attack it, should help get rid of it. Again, it can do this using antibodies. These are also known as immune bodies. These are proteins that help render the antigen harmless. Okay, they are going to help slow down the invader and also help destroy that invader. Now, common ways that your immune system fails, where it does not do its normal job. This could be allergies. When we look at allergies, guys, this is actually a hypersensitivity. This is where your immune system overreacts. Okay? Kind of like when you've had a bad day and somebody comes in and says, hey, how was your day? And you like go off on them and you yell at them, it was fine, or something like that. That's an overreaction. Okay, they didn't deserve that. And that's kind of what happens when you say you're allergic to a peanut and you eat something that has peanuts. That peanut didn't really do anything to you, but your immune system overreacts to it, which then causes you to get super sick. Same thing happens with just seasonal allergies with certain kinds of things, and some people have stronger allergies than others because of this. Another way your immune system fails is autoimmunity. Remember I talked about a minute ago that your immune system should be taught this is you, this is not you. With autoimmune issues, this is where your immune system decides it doesn't care if it's you and it attacks you. This is what happens a lot of times with rheumatoid arthritis in your joints. Crohn's disease is when your immune system attacks your intestines. Okay, so this is where your immune system starts attacking you, okay, when it shouldn't. The last immune system failure is immunodeficiency. This is where the immune system, if its level should be here, it's depressed. It's not able to fight invaders. This is something that you could be born with, where you don't develop immune system correctly, or you could acquire a deficiency, which is what HIV causes in AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. Okay, that's what AIDS stands for, and it's caused by HIV taking out your white blood cells, okay, making your immune system not able to fight like it should. Okay, so these are going to be areas where your immune system fails. All right, so let's switch gears a little bit and let's talk a little bit about aging. Aging, guys, is when we see a degeneration that takes place. Okay, your cells start to get old, your tissues start to get old. And because of this, we see that you can start developing diseases that are related to age. You'll see that people of old age have certain diseases that are more present. Tissue degeneration changes the function. The function gets changed with the activity levels. Then we see that your organs don't function like they should, and they are not going to be as efficient. Body's ability to repair and replace itself starts to slow down as you age. Okay, your body is pretty good at fixing things early on. But as you get older, everything in your body starts to get tired. It has a harder time doing its normal job. This is why you get a certain kind of cut when you're in your 20s. It'll heal a whole lot faster than somebody who gets that same cut in their 60s or 70s. All right, because their cells are just not as ready, or they're slower at fixing things. Same thing with broken bones. A kid might be in a cast for 4 to 6 weeks, whereas an adult may have the same break and they're in a cast for 8 to 12 weeks. It takes longer for those things to heal the older we get. Okay, so let's talk about when these cells get injured. What can cause injury to our cells? Okay, besides just like trauma and invaders, there are some other things that can cause injury. Now, causes of cellular injury and even death could be due to hypoxia. Hypoxia means we're not getting enough oxygen to the tissues. Well, wait a minute. Why do our cells and our tissues need oxygen? Ooh, this goes all the way back to general biology. We talk about cellular respiration. Remember, in cellular respiration, you need sugar, okay, like glucose, but you also need oxygen in order to change that sugar into ATP. Remember, ATP is how your cells function. It's how they use energy. Well, if we're not getting them the oxygen they need, they cannot get the ATP they need. This causes them to be injured and ultimately die. Okay. Another one is we can see that it is anoxia. That's no oxygen getting there. All right. So hypoxia means we're not getting enough, but anoxia means we're not getting any. Now, this a lot of times means that there could be a kink or a blockage of a blood vessel. Okay, blood vessels are what deliver the blood, which carries oxygen. Okay, and so there could be something that's causing them not to get there, the blood to not get there like it should. We also see that drug or bacterial toxins can also cause cell injury and death, and even viral infections. Certain viruses can cause cell injury and death. Now, the type of cell that is injured also plays a role on whether or not a cell can repair and regenerate itself. Remember, a lot of cells can undergo the process of mitosis, going from one cell to two. Okay, some cells in our body don't have that ability. They lose the ability to do mitosis. So if damage happens in those areas, we see the damage is more permanent. This is areas like your brain, your heart, and your nerves. Other tissues can regenerate very quickly and repair quickly, like your skin. Right, so it depends on the type of cell and what type of cell injury to whether or not it can be corrected or fixed. Now, if a cell is able to adapt, mean change based on the conditions that are present, then sometimes injury does not occur, okay? But sometimes it does. So some types of adaptation. All right, I've got some pictures here. One type of adaptation we have is atrophy. Now remember, when we add a in front of the word, it means not or without. In this case, it's a decrease of cell size. So in atrophy, this means we're not using it like we should. And because those cells are not being used, they start to shrink or decrease in size like you see here. Now, atrophy is something that happens to your muscles if you don't use them. Think about it. If you were to work out really hard on a regular basis for 6 months, your muscles are going to start to get larger. They're going to get more toned. But if you stop doing that, you're going to notice they're going to start getting smaller, and they're going to do it quicker than it took you to build them. Okay, it's just like if you were to have a cast before. Have you ever had a cast on, like your arm? When they took the cast off, it looked all skinny and sickly. That's because those muscle cells got smaller because they were not being used. That is a type of atrophy, okay, cell adaptation. So when we look at hypertrophy, this is when the cells increase in size. This is normally due to them doing extra work. So again, our muscles, when we actually work them out, they will get larger in size. Okay, we see that this might happen even in some tissues like the glands. When they get used more often, they may start to get a little larger. Okay, so this is where they get to be bigger. The next one is hyperplasia. The hyperplasia is when we have an increase in number. All right, so if you look, in this case, we had 4 cells to start with, but now we have 6 cells. So we've got more cells being produced. A lot of times this is due to hormone changes, especially in like women. We see that this hyperplasia could take place due to hormone changes. This might happen a lot of times like maybe in breast tissue, or it may even happen in the uterus itself. The next one we have is dysplasia. Dysplasia is where we see that the cell shape and size even starts to change, as well as some of its organization. Now with dysplasia, this is something that might happen in an area with high wear and tear, okay, where we see that the cells might be getting larger in size and in more number, okay, and kind of getting disorganized. This is what you sometimes see in like calluses on your feet, or even in the calluses like when you were a kid and you played on the monkey bars in this area, okay, where it got thicker. It was to help with some protection. The problem with dysplasia is that if we do not take away the potential thing that's causing the change in size and shape, this could potentially lead to neoplasia, which we see here at the bottom. Neoplasia is where we actually see the development of the tumor, uncontrolled growth. The middle one here is metaplasia. Metaplasia is where the cell changes to another type. Now, this does not mean, because we have 4 types of tissues, this doesn't mean that it goes from like epithelial to connective or changes from epithelial tissue to muscle tissue. It's going to stay within its normal classification, but it's going to change based on the environment. Guys, this is what happens for smokers. Okay, we see that you have column type cells that are running through your trachea, okay, your respiratory system, that have little hairs on them. And those hairs are supposed to help trap things and help you get rid of invaders. Smokers lose that ability. Those cells no longer have the cilia and they start to be more flat. And because they're flat, this means they can't catch things as much. That's why they have a smoker's cough, this cough to try to help get things out. Okay, because stuff is getting down into their lungs a lot easier than it used to. And that's due to metaplasia. Now, like I said, neoplasia is development of a new type of cell, but this is with uncontrolled growth. Anytime we have uncontrolled growth, that is going to be where we start to see cancers. And guys, once these cells don't care about the normal control systems that are in place and they start going rogue and doing their own thing, you start to see that the cells not only change in number, but they start to change in their function and what they do. And you can see that here in this picture where they are looking a lot different. Okay, if the structure changes, a lot of times the function also changes. And if the function changes too much, then it could hinder that organ that these cells are part of. All right, so this just does a little comparison for you. It shows the normal cells at the top. We then have atrophy, hypertrophy. We also can see hyperplasia. Now, hyperplasia could potentially start to lead to dysplasia. We have metaplasia, where we see the cells go from these column cells with the little hairs to where they go to cube type cells. And then we also have the neoplasia, which is the tumor. And in this particular case, you can see that the tumor is going into an area that it normally shouldn't. That red line, it goes below it. That's where we see where it has metastasized and moved somewhere it's not supposed to. So in this case, that would be considered cancer. All right, so this brings us to cell and tissue death. If a cell cannot adapt, it will ultimately end up dying. And cellular death is known as necrosis. Okay, so necrosis is cell death. Now there's 4 kind of big types or categories of necrosis. The most common type or category is coagulative. Coagulative necrosis normally begins with ischemia. Now, ischemia, guys, leads to hypoxia. We talked about hypoxia being lack of oxygen. Guys, ischemia is lack of blood flow. So not only is it not getting the oxygen to the tissue, it's not getting the blood out of the tissue. And so we're not delivering nutrients, as in oxygen, and sugars, okay, food. But we're also not taking the waste products away. All right, so we're not getting the good stuff to them, but also the waste and the trash is building up and not leaving. All right, so it's kind of being hit twofold, 2 ways there. Liquefactive is the next one. Liquefactive is formation of abscesses or cysts. This is from dissolved dead tissue, and it forms a pocket with fluid in it. Okay, that's where the liquid part comes from for the liquefaction. We also see we have fat necrosis. Fat necrosis is death of adipose tissue, so fat tissue. This is a result normally of trauma or something like pancreatitis, inflammation of the pancreas. A lot of times, guys, fat necrosis appears as a chalky white area in the tissue, and it will have kind of a soapy look to it. It'll look like it's kind of slick. Okay, so it has a chalky white type of tissue that's present. Caseous necrosis is characteristic of like lung damage, normally due to something like tuberculosis. Guys, tuberculosis is a real disease and it does kill many people every year, just not in the United States. When we look at this, though, when we see that tuberculosis is treated, there's still damage that's left behind in the lungs. This damage is caseous necrosis, and it resembles clumps of like cottage cheese. Okay, so it's cased in a case and it looks like clumps of cottage cheese. So these are kind of the 4 types. Now again, I want to hit on what ischemia means. Ischemia is a decreased blood flow. This decreased blood flow causes power failure in the cells. Now this means the mitochondria, remember the powerhouse of the cell, cannot create ATP. If no ATP is being produced, the cell starts to die. Now, if there's no blood flow, there's a disruption in oxygen and food supply, and there's also accumulation of the waste products. So again, talking about being hit on both sides. When blood flow has been decreased or stopped to an area and the cells start to die, that area of dead cells is called an infarct. Okay? An infarct, when we look at this, a lot of times we'll call it like a cardiac infarct. This is telling you that an area of the heart cells have died. Okay, and so when they call it an infarct in a certain area, that means that there is an area of dead cells that are present. Okay, and that is a type of necrosis that's happened. Another thing we want to look at in necrotic tissue or necrosis is something called gangrene. Gangrene is where we have saprophytic bacteria, okay, that comes in and it starts to eat away at that dead tissue. Okay, it gives kind of the perfect environment for this bacteria that's going to start destroying more and more tissue. Now, there are 3 categories of gangrene. There's dry gangrene. Dry gangrene is from coagulative necrosis. Coagulative necrosis means we've stopped blood flow. This is characterized by blackened, dry, and wrinkled tissue. Okay, they're separated by a line, okay, where we can see healthy tissue on one side and the dead, dry tissue on the other. On the other hand, wet gangrene is the liquefactive necrosis. This is typically found in your internal organs. A lot of times wet gangrene can be more fatal. But guys, it gets its name because it looks more wet, because the cells as they're dying are creating that fluid that is present. So swelling a lot of times occurs here because of the collection of that liquid or fluid. Gas gangrene is the last category or type. This results from infection of necrotic tissue by anaerobic bacteria, specifically Clostridium bacteria. They like the anaerobic conditions where there's no oxygen. As long as there's no oxygen, they can grow and flourish. This is characterized by formation of gas bubbles. They actually produce a gas. The gas collects in the tissue and it starts to damage the underlying tissues like the muscle. It starts to pull the skin and the tissues away from each other, okay, causing more damage. Most of the time, gas gangrene can be fatal if it's left untreated. And treatment is going to be extensive and be long-term because of the damage that's taken place. So let's take a look at some pictures real quick. So this first picture right here is the dry gangrene. Remember, it said the dry gangrene is going to appear black, leathery. Okay, it's going to have this dry type appearance, and you can see that here. On the wet gangrene, do you see the swelling and the fact that it looks like it's weeping? The wound is weeping. That's going to be the wet gangrene. And the bottom picture is the gas. You can see the gas bubbles that are forming. That's pulling the tissue away, along with all the purple area is that necrotic tissue. As most of the time when we talk about gangrene, we've got to get rid of all the necrosis, which means we may have to amputate to a certain point or use very high level types of antibiotics. Okay, gangrene is not something we want to deal with, especially if it goes into the deep tissue of the muscle and the bones. All right, so we talked a little bit about tissue death, which is known as necrosis. But guys, when an organism dies, like an individual, a person, this is known as mortality. Mortality is the death of the organism. On the other hand, we also see morbidity. Morbidity means the state of being diseased, okay? You'll notice a lot of times that with certain diseases, they're going to end up sending reports in to like the CDC or certain kind of areas where they're going to report the morbidity rate. The morbidity rate is how many individuals are diseased, and then the mortality rate, which is how many people have died from the disease. All right, and so mortality and morbidity are different, but the morbidity could lead to mortality depending on the infection or disease that's present. Now, in order to be considered dead, when we talk about a human being, there's some criteria that takes place for brain death. Okay, you have to be considered brain dead in order to be considered dead. Now, this is a lack of response to stimuli. So the individual is going to have a lack of response. A loss of all their reflexes. This tells us the nervous system has shut down. Absence of respirations. They cannot breathe on their own, and the lack of brain activity. Now, guys, when they look at brain activity, they're going to set up an EEG. This is an electroencephalogram. It's where they set up the electrodes on the brain. They're going to watch for brain waves, okay? They're going to take an electroencephalogram, and then 24 hours they're going to take another one, and they're going to look for any kind of changes or activity to see if activity has increased or decreased. If there's absence of activity in the first EEG and there's absence of activity in the second EEG, the person is considered brain dead. And that is where they will remove the other life supporting type of equipment like ventilators and that sort. All right, so this kind of ends this particular look at where we're talking about types of diseases, the types of classifications. Also looking at cell adaptation, when sometimes the cells can adapt and change based on what's happening to them, but also looking at when the cells and tissues die through necrosis and gangrene, and also when the organism as a whole is considered to be dead. All right, so this finishes up chapter 2. If you have any questions or concerns, please let me know.